My name is Samantha Larson, and I attend Aspen University. I am in N355P, Adult Health 1. My professor is Professor Norbert, RN, MSN, ED, and today is December 30th, 2019. Today I will be describing the eye, so I will start out with outlining a structure. So the structure and functions of an eye. So as you can see here, I have got a diagram of an eye. We'll start out with the eyelid. So this is the eyelid, and the function of the eyelid is basically protection. It protects the eye from physical harm. Then if you go to the right, it is the ciliary muscles. And the ciliary muscles, they basically change the shape of the lens when they contract. This white space right here, it is the vitreous humor. Okay, and the vitreous humor, it is a jelly-like fluid, and it helps to keep the shape of the eyeball, and it also bends light onto the retina. Right below the vitreous humor is the retina. And the retina are basically light-sensitive cells, and they send impulses to the optic nerve. This little bulge right here, as you can see right there, that is the fovea. And the fovea is a small area of the retina, and it contains only cones. And then this little triangle area here, that is the blind spot. It's the point at which the optic nerve leaves the eyeball, and there is no retina. I'm just going to write that, blind spot. Okay. All right, and then this line right here, that is the optic nerve. All right, and then if you come over here, this part, that is the sclera. Okay, and the sclera is the tough, strong outer layer, and that is responsible for protecting the internal workings of the eye, and it has a lot of blood vessels which actually supply the retina with food and oxygen. Then if we come over here, this red layer right here, that is the choroid. Okay, and the choroid is a dark and pigmented layer. It actually absorbs light and stops it from being reflected back into the eye. And then these lines right here that you see, that is the suspensory ligaments. And then the suspensory ligaments, they hold the lens in place, and then they connect it to the ciliary muscles. And then this large ball-like thing here, that's the lens. And then the lens is a clear disc which focuses the light onto the retina. It actually gives fine focus. And then this space right here, that is the pupil. And then the pupil is the hole in the middle of the iris where the light actually enters the eye. All right, and then this kind of roundish part right here, that is the conjunctiva. And the conjunctiva is a thin, clear, protective layer which goes over the surface of the eye and the lining of the eyelids. And then if you go down here, kind of in it, just below the conjunctiva, you have got the cornea. And the cornea is a clear area of the sclera, and it helps to bend light onto the retina. And then this white spot right in here, that's called the aqueous humor. Q-U-E-O-U-S. And the aqueous humor, that's the fluid that fills the front of the eye, and it helps bend light onto the retina. And this kind of line that goes down here, that is the iris. And the iris is, it's what controls the amount of light which enters the eye, and it does that by changing the size of the pupil, and it's actually a muscle. Okay, so now we're going to move on to disease processes. The disease processes I picked were dry macular degeneration, glaucoma, and cataracts. So dry macular degeneration, it affects the macula, which is a part of the retina. So the retina is back here, if you can see this part, and the macula is a part of the retina. So it's actually a dry macular degeneration is essentially thinning of the macula. Clinical manifestations can be like visual distortions, a reduced central vision, difficulty adapting to low levels of light, blurring of printed words, inability to recognize faces, and a decrease in the intensity of colors. It can be diagnosed by examining the back of the eye, so like, back here. Treatment includes low vision rehabilitation. Go back to diagnostics. Examining the back of the eye, testing for defects in the center of vision, fluorescein angiography, indocyanine green angiography, and optical coherence tomography. Treatment includes low vision rehabilitation and a surgery, and you actually implant a telescopic lens. Management for interprofessional care may consist of a nurse, doctor, and ophthalmologist. For health promotion, you'd want to manage pre-existing medical conditions, cease smoking, exercise on a consistent basis, and keep a healthy weight, and then I'll eat healthy with fruits and vegetables, and also eat fish. Clients should be taught to stay up to date on regular eye exams, which will assist in the early signs of macular degeneration. Okay, so for glaucoma, damage occurs to the optic nerve, which is again right here. The client will have could have patchy blind spots in peripheral or central vision, which would be like, peripheral is kind of on the sides, and then central is right in front. Tunnel vision, severe headaches, eye pain, nausea and vomiting, blurred vision, halos around lights, should be like when someone sees a light bulb like that and they see a halo around it. And eye redness. To diagnose it, it'd be a tonometry, testing of the optic nerve for damage, performing a visual field test, measuring the thickness of the cornea, which is, you said right here, and looking at the drainage angle. Treatment. Prescription, to treat it, you can prescribe eye drops, which would include prostaglandins, beta blockers, alpha adrenergic agonists. You can also treat it with oral medications, and surgery may also be a treatment. Again, interprofessional care may consist of the nurse, doctor, and ophthalmologist. For health promotion, eye examinations regularly with dilation. The nurse and healthcare professionals should also know the eye health history of the family. The client should exercise safely, take eye drops as prescribed, and wear eye protection. Clients should be taught to stay up to date on regular eye exams, which will assist in the earlier detection of glaucoma. Okay. All right, and now cataracts. Cataracts is clouding of the lens. So this part right, the lens is affected. Clinical manifestations will consist of vision that is dim, blurred, or clouded, difficulty seeing at night, a sensitivity to light and glare, seeing halos, which is again the light with kind of like the halo around it, needing brighter lights, eyeglass prescription changing frequently, color fading, and double vision in one eye. It can be diagnosed by a visual acuity test, a silt lamp examination, and retinal exam. So, an exam of this part right here. Treatment can include prescription glasses, and if the prescription glasses don't work, then surgery may be the only option. Management consists of the nurse, doctor, and ophthalmologist. Health promotion consists of having regular eye exams, not smoking, managing pre-existing health conditions, eating a healthy diet that has lots of fruit and vegetables, wearing sunglasses, and limiting the use of alcohol. Clients should be taught that cataracts can't currently be prevented, as there's no scientific evidence that they can be prevented. But clients should be taught to seek regular eye exams.